sir.
Thank you guys. Just give me a minute, we can start the session. So today onwards, we can discuss the ICD-10 PCS. Coding concept we can discuss. So in this ICD-10 PCS coding, you will get 2 to 3 case studies and 2 to 3 multiple choice questions. Okay, 2 to 3 case studies, 2 to 3 multiple choice questions. So first thing, remember, do not focus mostly on the PCS and all. Okay, just understand the code leading. Hardly we need to code 10 codes, 10 procedures. Hardly you will get in the exam point of view for PCS. So for that, rather than practicing weeks and all, that 10 codes if you practice or if you mug up enough for the PCS. Okay, don't put most pressure on the PCS for the clearing of exam, guys. Just understand what are the codes we need to practice and how to use the book leading, how to find the code. Everything should be optional in exam point of view. Just we need to find the correct answer based on the options and we need to apply some guidelines. That's it.
So the
So
case studies also will be provided the option, sir.
everything should be options in exam. Okay, either case studies or multiple choice. Everything should be optional. We are not coding directly anything in exam. Every question should be optional in exam, guys. Either multiple choice questions or case studies. Every question should be options. You don't get keyboard to add the diagnosis in the exam point of view. So ICD means, everybody know, right? International Classification Disease 10th revision procedural coding system. PCS means procedural system. Okay. So these PCS codes used in the inpatient facility. Okay, used in the inpatient facility procedures. Inpatient means
who are admitted in hospital.
Outpatient means
Less than 24 hours the patient.
that patient also admit in the hospital, right?
If it is less than 24 hours,
24 hours it is inpatient, more than 24 hours it is less than 24 hours it is outpatient, more than 24 hours inpatient.
Correct. Who stays in the hospital more than 24 hours, it should be considered as inpatient. Who discharge within 24 hours, considered as outpatient. So here for the diagnosis, ICD-10 CM codes was same, any facility, either inpatient or outpatient. At what facility they found the diagnosis, you will get ICD-10 CM codes for diagnosis of disease. For the procedures, based on the facility setting, we need to check whether they performed in inpatient or outpatient. Okay, whether they performed in inpatient or outpatient. So based on the facility setting, you will get the procedure code. If they perform the procedure in inpatient facility setting, you will get the PCS codes. If they performed outpatient, OP means outpatient, guys, remember. OP facility procedure. CPT. Okay. Outpatient facility CPT codes for the procedure. Procedure should be same, guys. Operative report should be same. Based on the facility, whether they are performed in the inpatient or outpatient, that we need to identify. That's it. So first thing, how can I identify in the exam point of view whether they performed in inpatient facility or outpatient facility? Simple. Based on the code structure itself, we can identify whether it was a outpatient procedure or inpatient procedure. In the exam point of view, every question and every procedure should be optional. Okay, every question should be optional. Just check the option whether they given 5-digit code or 7-digit code in the procedure column. If they given 5-digit code, it should be CPT. Whether it was a 7-digit, it should be PCS. Okay.
Yes, sir.
Simply we can identify.
ట్రిపుల్ పట్టుకెళ్తాను ఇప్పుడు కావాలిగా.
This is the difference for procedure. Now we are going to discuss about PCS. So all the PCS codes, 7-digit alphanumerical codes. All the PCS codes, 7-digit alphanumerical codes. Okay. You will get all the letters and numbers except O, I. O and I except. Because confusion of 0 and 1, they are not using O and I in the codes. So you can pronounce like O or 0, I or 1. The meaning should be 0 and 1. So if you pronounce O or 0, same. Okay, there is no O in the PCS code. These 2 letters we don't get. Remaining all the letters and numbers you will get in the procedure codes. So first thing, everybody know ICD leading here. 10 cm, not PCS.
Yes, sir.
Leading everybody know na how we need to identify the code first. If they given any disease, how you find?
No, sure, I don't know.
No problem, I will teach. Remaining all no, right?
Yeah, first to go to alphabetic and then to tablet.
Yes.
First we need to check in alphabetic index, then tabular list, comma. Yes or no, guys? Don't tell me I don't know the ICD code leading.
Yes, sir.
Yes, sir. It was basic thing to code ICD. For working in the ICD coding, I don't know ICD leading means it was very shameful for us as a coder.
Shiva, I'm not getting into ICD because I'm not a coder at all. I am into investigation.
No problem. I tell to you already. I explained for you. Right?
Okay.
Check as a coder. Everybody aware of ICD 10 cm leading, right? Simple. Alphabetic index, then tabular list. Okay. Then tabular list. Same here also. You will get complete code in alphabetic index in ICD 10 cm.
No.
No, sir.
Sometimes you will get, guys, who said no. Sometimes you will get complete code in index itself. you will get complete code sometimes in index. Sometimes we need to go for the further characters in the tabular list. But every code must verify in the tabular list. That's it. Suppose if you wanna code lead hypertension, directly I10 you will get in the index. Okay. You will get in index sometimes ICD-10 CM codes. Sometimes we don't get. Same in PCS also. You will get index and tables. Okay, ICD-10 PCS also same, guys. ICD-10 PCS also index and tables. Okay, you get the index, then tables. So index means how to use the index. Index was like dictionary. You get the procedure names sequence wise, alphabetic wise, A to Z. Okay, A to Z you will get. So then for the remaining characters, we need to go for the table. Sometimes if they get 7-digit in index, that's the procedure. In ICD-10 pieces also, sometimes you will get code in index completely. Sometimes we need to go for the remaining characters in tables. Minimum 4 character code you will get in the index. Out of 7-digit, minimum 4 character will get in the index. For the remaining characters, we need to use the tables. Okay. So first thing, as per like ICD-10 CM and CPT, we don't get direct code here. We don't get direct code like CPT and ICD-10 CM. You will get the code and description. Here, we need to identify each character. In the PCS, you don't get complete code directly. We need to identify each character. First thing, remember, we are not going to get complete code like ICD-10 CM or a CPT coding. It was completely different. We need to identify the each character. Okay. Like ICD-10 CM and CPT, we don't have any specific name for each character. Suppose 5-digit CPT code means we don't have any specific name for each character 1, 2, 3, 4, 5. In CM also we don't have any specific name for each character number value. But in the PCS for 7 digits, each character have specific meaning and own definition. We need to learn about the 7 characters. First thing, we need to understand the 7 characters definitions. Then only possible to lead a PCS code. It was completely difficult rather than the CPT and ICD-10 CM. You don't get direct code. So put more focus to understand the concept, how to lead the code, how to find the code, and what is the each character meaning. Then only possible to get a code. Got it? Do not take negligence, guys, in the PCS. So first 7-digit names note down of the PCS character. Section, body system, root operation, body part, approach, device, qualify. These are the 7 digits. We need to learn each character. Okay, section, body system, root operation, body part, approach, device, qualifier. These are the 7 characters of PCS code. Any doubt?
No, sir.
So now we can discuss each character. So first thing we can discuss, what is the meaning of body part? What is the meaning of body part? Tell me generally. body part means in our body. Generally, tell what is the meaning of body part? It was not different.
Anatomical body systems.
Not system different, part different, right?
Eyes,
Body
nose.
Body organ.
Like hand.
body organ,
And leg on.
uh, organs, body organ should be the body.
Location of
Location in our
body
body.
side.
Side, it should be the body part. So guys, fourth character represent body part in the procedure na. So body part means in the body system we have different organs, correct? Each body system have different organs, right? In the suppose in the respiratory system, what are the parts we have?
Lungs,
Lungs.
Bronchus, lungs, bronchioles, alveoli, trachea, correct? These all are body parts, right? In the lung, upper lobe, lower lobe, middle lobe, right lung, left lung. These all are body parts, right?
Yeah.
These all the body parts comes under which system? Respiratory system. So here, first note down the fourth character, body part. Body part. Body part, fourth character represent site of the procedure. Body part, fourth character represents site of the procedure or location of the procedure. Where they are performing the procedure, the fourth character will represent. Okay, where they are performing the procedure, fourth character will represent. Okay, find fourth character more accurately. Okay, while we are taking the body part, we need to find more accurately, guys. Look laterality, whether they are performed right or left. Suppose they performed in the lobes, check correct lobe. Suppose they are performed upper, middle, lower, you need to check exactly. If they performed proximal or distal, check properly. Okay, everything we need to check carefully in which area they are performing exactly. Suppose they mentioned lung, whether it was lung or any lobe they mentioned. In the lung we have different lobes, right? Upper lobe, middle lobe, lower lobe. Suppose they perform the esophagus, check upper esophagus, lower esophagus, middle. Okay, suppose they performing in the colon, check for ascending colon or descending colon or sigmoid colon most accurately. Suppose they done the procedure in finger, which finger they performed, first finger, second or third, right finger or left finger, more accurately, point to point, you need to identify the body part after reading the procedure. Clear?
Yes, sir.
They will mention in the operative report clearly where they are performing the procedure. That location you need to identify and you need to pick in the code properly while leading. Suppose if they done lung, don't go with directly lung. We check carefully in the record whether right or left or any lobe they used, like that. Half of record do not read. Half of question don't read in the exam. Read question completely once or twice. Do not come in exam within 2 hours, within 3 hours. Okay, it was not running race. Whoever come first, they won't give any medal. Spend your 4 hours time in exam carefully. Review if you have time. Read question once or twice. Okay, lot of people I see they are coming within 2 hours. Okay, don't do like that. Read question and operative report twice or thrice also if you have not understand it. If you are well and good to understand the document in one time, enough. Okay. If you understand the question, no problem. Where they are correctly performing the procedure, you are finding no need to read 2 times, 3 times. Whenever you are lack of finding the location, check carefully. Now clear, right? Fourth character, how to find?
Yes, sir.
Any doubt? Body part, guys? Body part means site of the procedure or location of the procedure. Any doubt?
Clear, Shiva.
I will show some procedure notes. You can identify body parts. Okay. See here where they are performing the procedure. Like this, we'll get the operative report.
The skull, is it? Head or skull, like
Skull fracture, they reduced, correct?
Yes.
Yes, sir.
Yes, Shiva.
Oh. Now you get idea, right, how to find the body part. So here check where they perform the procedures.
Left hand.
Left hand.
Upper arm.
Left hand.
Upper arm.
Craft is taken from left upper arm.
Surgery for left hand.
Wherever they perform, left
Left
arm,
Left hand.
left hand. Okay. Where they perform, patient admitted with for corrective surgery. Keloid left hand due to burn experienced in bushfire 1 year ago. Radical excision of the scar was carried out and the defect was covered with full thickness graft taken from left upper arm. The patient was discharged. They taken the graft for upper arm and they done the left hand correction. Correct? Graft collected from the upper arm and they perform for the hand. Correct?
Surgery for the left hand.
Yes, Shiva.
Next. Here perform where they perform the procedure.
Right foot.
In the
Amputation.
right where they done.
Amputation.
Right foot.
Right hand.
Right foot.
Tarso metatarsal, right?
Tarso.
Tarso metatarsal of the right foot. It was exact location should be tarso metatarsal. In the foot where they are performed also we need to find. Clear? Huh? Like this, we need to find body part accurately. Now you are finding the body parts, right? In the procedure. So come to the next character, second character. What is the second character?
Body system.
Body system, right? Body system means anatomical body systems, guys. After identifying the fourth character, location, that body part comes under which body system? You will get in the second character. Interrelation. Suppose they perform the procedure in lung. Lung comes under which body system?
Respiratory.
Respiratory.
Respiratory. You will get in the second character, body system. So first identify the body part, site of the procedure. Once you open the operative report or question, identify the body part. After identify the body part, simply we have basic anatomical knowledge. Okay, which body part comes in our body, which location. This knowledge enough. Lung means which body system. Eyes means what is the body system. Heart means what is the body system. This basic anatomical knowledge must, guys. Okay. So I don't know the anatomy means I can't able to find the body part comes under which body system means I can't able to do anything. Definitely, at least we need to get idea. Brain means comes which body system. These all are common body system. Okay. So in the second character, based on the body part, that body part comes under which body system, you need to find in the second character. Got it? So total we have 31 body systems in the PCS code. Actually, body systems divided as 31 in the PCS code. Normally 12 anatomical body systems. Here they elaborated more. Total 31 body systems. Each body system have own value. These are the fixed values, guys. Okay, these are the fixed values. Okay, it won't change. If they done any procedure for heart, what is the second character?
2.
2. This value you will get. Suppose they done the procedure for upper bones, what value you will get in the second character?
P.
P. Okay, like this we have total 31 body systems. So one body system, I will explain what are the body parts comes and all. You can note down if you don't know. If you already have a basic idea, leave it. So first, central nervous system, 0. What are the body parts we'll get mostly in the central nervous system?
Brain, spinal cord.
Brain and spinal cord. Okay, brain, spinal cord related. If they done the procedure, you will get the central nervous system. And cranial nerves also note down. Brain, spinal cord, cranial nerves. Cranial nerves. Then peripheral nervous. Peripheral means other than the spinal and brain related. Extremities nervous system should be peripheral nervous system. Okay. Other than the spine and brain, spinal cord and brain, cranial nerves. Remaining all nervous system should be peripheral nervous system. Then heart related and great vessels. Note down the great vessels. What are the great vessels you will get in the second?
Vena cavas.
Superior vena cava. Okay. Inferior vena cava. Aorta. Superior vena cava, SVC means, okay. Superior vena cava. Inferior vena cava. If they perform for this also, you will go with heart and great vessels. In the heart, what are the body systems you will get? Mostly
Circulatory.
Cardiac.
chamber, heart chambers, heart valves like aorta
Valves.
valve. Okay. Then mostly remember coronary artery. This artery, where it will be located?
The heart itself.
Heart
Supplying
itself,
heart.
it will supply the blood to
Heart.
heart muscles. Okay. Coronary artery also located in the heart. So mostly you will get question from coronary artery. Okay. Coronary artery also part of heart. Noted?
Yes,
Next.
sir.
Upper arteries and lower arteries. See here onwards, arteries and veins totally they divided as 4 body systems. That's why I'm telling coronary artery will get in the heart and great vessels, not upper and lower artery. Okay. So arteries and veins they divided as 4 body systems: upper arteries, upper veins, lower veins. What is the midpoint to divide arteries upper and lower, veins upper and lower? Anybody have idea? Diaphragm should be the midpoint. Okay, note down. Diaphragm should be the midpoint. Where it will be located?
Below lungs.
Below the lungs. Upper and lower artery and vein. Divide. Right. Diaphragm. So all the arteries and veins above the diaphragm, upper arteries, upper veins. Below the diaphragm, lower arteries, lower veins. Clear? So here we need to get idea that artery or vein located in our body where. Suppose if they mentioned femoral vein, where it will be located, for example,
Lower
femoral vein,
in the leg.
leg,
Upper
right?
side.
The femur. Okay.
Femur. So where it will become lower vein or upper vein?
Lower vein. Lower vein.
Lower vein. Okay. Like this, we need to get basic idea. Okay, what? Artery or vein they mention now where it will become in our body. We need to have basic idea. Then only possible to get
Should
upper
we
artery.
memorize every single vein and artery, sir?
I didn't get you.
Should we learn every single artery and vein because some will not give us clue where it is?
No need to learn maximum. Just aware. Okay. Exam point of view, no need to go with that much level of knowledge. For coding, you need. Okay. If you wanna work in IPDRG, you need to learn on that much level. Each artery and vein where it will be located. Exam point of view, just remember, I will tell what are the arteries, veins will get in exam. Okay. If you wanna learn really knowledge, you need to read all the veins and arteries. You need to open the circulatory system and look. Next. Lymphatic and heme. Lymph and heme related 7. Eye related procedure 8. Ear, nose, sinus 9. From here, the body system, some body systems divided as 3-4 body systems here. Respiratory B. Then mouth and throat, gastrointestinal. There is no digestive guys here. So gastrointestinal means stomach and intestine. Mouth and throat means if they performed in the mouth and throat, it should be the separate body system here. Clear? Then hepatobiliary and pancreas. Hepato means
Liver.
Liver.
liver. Biliary means
Bile.
bile duct or gallbladder. Okay. Bile duct, gallbladder, and pancreas. If they perform the procedure for gallbladder, bile duct or bile, liver, pancreas, you will get F. Okay. Then endocrine, all glands you will get in the endocrine, like adrenal gland, pituitary gland, thyroid gland. Okay, all glands will get in this G. Next, H, skin and breast, includes skin and breast glands and ducts also. So from H onwards, check if it should be interesting. Based on the depth, the body system will be changed. If they perform the skin and breast level, H you will get. Suppose if they performed on subcutaneous and tissue, fascia J, muscle level K, tendon level L, bursa and ligament M. So J, K, L, M and H, J, K, L, M. This 5 body system was similar. Based on the depth, the body system will be changed. Suppose they perform the debridement on leg muscle level. What is the body system here?
Hey.
Muscle. So same, the debridement performed on the left leg, skin level. H.
J.
H. Okay. Suppose they perform the debridement on subcutaneous tissue level on left leg.
J.
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 So, at what depth they are performing, you need to check first. Simply, some people what they will do now, if they done debridement means or laceration repair means, if they find the location and they forget about body system, anyone they will go for that body part and they will take any body system. They won't check the body system. So if the procedure was depth, skin depth related procedures, first identify the depth. At what level they are performing, subcutaneous level, muscle level, bone level, tendon level, skin level. After, you can find the body part. Okay. Then bones, they divided as 3 body systems: head and facial bones, upper bones, lower bones. Then upper joints, lower joints. What is the difference between bone and joint?
Joint connects the bone.
Connection.
Joints connects the bone. Bone means
Structural framework of the body.
structural. Okay, strongest structural body part. So here remember the location if they given, it should be bone or joint, you can identify first. Suppose they given femur, it should be bone or joint.
Bone.
Shoulder,
Joint. Upper joint.
hip,
Lower joint.
Joint.
joint. Radius,
Bone.
Bone.
here, so note down where we can divide upper bones, lower bones, upper joints, lower joints, na lumbar 5 below. Okay, hip onwards, hip and hip below, lower bones, lower joints. Hip also lower joints, hip and hip above, all upper bones, upper joints. Okay, noted, where we can divide
The
a bone
lumbar
and
region
joint.
comes in the upper.
Hip you can remember, okay? Hip
Okay.
and hip below.
The sacrum and coccyx.
Low.
Okay.
L5, okay? L5 should be point for dividing of upper and lower. Lumbar 5. Then urinary system, female reproductive system, male reproductive. Then anatomical regions general. In our body have on regions, right? Body regions. We have
9.
body systems, no? Like peritoneal region, abdominal region, thoracic region, pelvic region. If they done cranial region, if they done any procedure in the regions, body regions, you will get anatomical region general. Okay, if they done any procedure on the region, W. Then anatomical regions, upper extremities, anatomical regions, lower extremities. Upper extremities means hands, lower extremities means legs. Upper extremities means hands, lower extremities means legs. Here, do not confuse, guys. Lot of people doing confuse here. Suppose they given in the extremities, hands and legs, any bone or joint specific name. We need to go with upper bones or lower bones, upper joints or lower joints. Do not take upper extremity, lower extremity. Suppose they given elbow. Elbow comes under upper extremity. I will take upper extremity. Don't do like that. Elbow means you need to go with joint only, clearly. Whenever they not specified any bone or joint name, simply they given finger, leg, toe, foot, okay, hand. Then we need to go with upper and lower extremities. Clear?
Yeah.
So these are the fixed values in the second character. If you seen in the second character in the option any value, it should be fixed. If they done any respiratory procedure, you will get secondary character B only. If they done any gastro related, D only. Any liver related procedure, you will get F only. Any gland related, you will get second character G only.
Shiva, can you please explain W again? Anatomical regions.
Regions, anatomical regions in our body have cranial region, peritoneal region, abdominal region, thoracic region, pelvic region. In whichever region they perform the procedure, you will get W. Clear?
Yes.
Yes.
Thank you. Next. Second and fourth character we covered as of now. Next, note down fifth character. What is the fifth character?
Approach.
Approach. We have total 7 approaches. We have total 7 approaches. You need to learn about the approaches, guys. This is most important topic. Okay, whoever learn properly approaches, then you will find code very easily. Okay, approaches should be most important in the PCS code. So total 7 approaches you will get. In this 7, any one approach they will use to perform a procedure. These approach values also fixed values. Okay, this approach values also fixed values. Now I am going to PCS book. Everybody who are having Xerox books, you can use Xerox. Who are not having Xerox, open the PDF in your mobile or lab. Now onwards, listen carefully. Whoever have any doubt, stop me immediately and ask me. If you understand the book leading, then remaining all should be easy. Okay. If you are unable to understand the book leading, then PCS code was very difficult. Once you open the book, any book, table of contents should be important, guys. Table of contents should be important. Okay. Here you will get all the details of the book, page numbers, what are the page numbers, what you will get on the particular page number, what they mentioned, everything you will get detailed in the table of contents. So if you open the table of contents, we need to look for all the headers like preference, changes of 2026 list, official conventions, ICD-10 PCS guidelines, anatomical illustration, PCS index, PCS tables, then medical and surgical. So here all the 31 body systems, whatever we discussed, you will get here. All the 31 body systems you get here. Correct? Same second character value, same 0, 1, 2, 3, 4, 5, 6, 7. All the values you will get book only. No need to remember the values also. Everything you will get in the CPCS book. All the 31 body systems. Then come to the appendix A. What they mentioned here?
Approach table.
Approach.
Approach table. Now we need to go for the approach table in the PCS book. Appendix A, approach table. See, the approach table data comes directly from the Center for Medicare and Medicaid Services, CMS. So whatever they given the guidelines here, we need to follow. Okay, we should not argue with this. Why they taken that guideline only like that? Okay, whatever they mentioned, that should be the guideline. This table provide list of all ICD-10 PCS approaches that a patient might be used the mean of access to perform a procedure on a patient. Okay, any one approach they will use to complete the procedure. Sometimes two approaches also they will use. Okay, if that not possible to perform in single approach, they will take another approach also. So total we have 7 approaches. This is the approach name, 5th character value, definition, and example of the approaches. Whoever understand these approaches, they can get easily score in the PCS. So first read up to 8. External open percutaneous endoscopy via natural or artificial opening, via natural or artificial opening endoscopy. Up to here, everyone read, guys. Take 5 minutes time and read the guidelines.
The recording has stopped.
Read all the definitions and examples. I will ask the questions. Don't complain me, guys. You are pinpointing me only. Why you are asking me only like that? Okay, if you have any issue in that like that, you can tell me directly. You don't ask me anything like that. I will don't touch. Read up to 8, okay? Via natural or artificial opening endoscopy. Up to 8, you can read once. Definition read. Examples also remember. Done. Read it, guys.
Yes, sir.
Yes, sir.
Yes.
Yes.
Sir.
This meeting is being recorded.
So first thing, external value should be X. External means any procedure they performed directly or indirectly applying the force, okay, in the skin, and they complete the procedure. Skin level procedures here. Okay, directly they perform on the skin or indirectly they apply some pressure on the skin and they complete the procedure. It should be external approach. Like closed reductions. From externally they will put splint or cast and they will reduce the fracture. Okay, or skin level laceration repair, skin level debridements. Okay, any procedure they performed visible part in the mouth. Okay, after opening your mouth, if they done any procedure, it should be also external. Okay, like laser surgeries, electric shock waves, all comes under external approach. Then open. Open means it was normal procedure. Okay, they will cut the skin or other mucous membrane, other layers, and they will reach the procedure site and they will complete the procedure. Again, they will suture it after completing the procedure. Okay, it should be open. They will open the body part. They will open the site of the procedure to perform a procedure. It should be open. Percutaneous means entry by a puncture or minor incision. Entry by a puncture or minor incision. Here they don't cut, they will puncture our body with needle or scalp or blade, small puncture or incision. Okay, catheter insertions, wire insertions, okay, drainage abscess incisions. If they puncture our body or they insert a minor instrument, it should be percutaneous. Puncture or minor incision. So note down when we need to code the percutaneous approach. If they mention like needle, catheter, guided wire, incision, puncture, noted. Percutaneous guide. Thank you. So if they done any needle or puncture or minor incision or guided wire or catheter, it should be percutaneous approach. Then percutaneous endoscopy. Scopy means
Visualization.
Visual.
video.
Examination.
Visualize. We examine.
Video. Okay, scopy means video. For that scopy was a instrument. They will connect with camera. Okay, they will connect with camera and they will insert our body and they will visualize in the computer and they will perform the procedure or they will examine the body part. Okay, With Scopy, they will visualize the location, examination of body part. Sometimes they will do procedure also. Okay. If they perform any procedure with percutaneous endoscopy, you will get the 4. So here, Scopy insert by puncturing or by puncturing, they will insert a Scopy. It should be percutaneous endoscopy. So note down laparoscopy, arthroscopy, thoracoscopy. Laparoscopy, thoracoscopy, arthroscopy.
Can you repeat again, please, sir?
Laparoscopy, arthroscopy, thoracoscopy.
Yes, sir.
Done, guys.
Yes, sir.
Yes.
Laparoscopy, arthroscopy, thoracoscopy. Are you able to ask?
The recording has stopped.
Give me a minute, guys. Suddenly my lap was damaged. I will connect tomorrow, okay?
This meeting is being recorded.
Thank you, guys. Bye bye.
Thank you.
The recording has stopped.